Namaste. Welcome you all for the yoga session. In this session, we are going to use a mat and couple of blankets. We are going to do some preliminary postures that helps the complete mind and body. To begin with, lie on your back, fold both the legs, heel closer to the hips, foot parallel. Keep both the palm on the abdominal cavity, neck at the center, chin towards the chest. Relax the complete back. Watch your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Watch the complete abdominal cavity. Watch the posterior region that is resting on the mat. Press both the foot. Tighten the calf muscles and the hamstrings on both legs. Develop a feel for the breath. As you inhale, the bottom of the abdomen, middle, then top of the abdomen should expand. As you exhale, it should contract. Simultaneously feel the massaging effect of breathing on your lower back. This breathing has to be maintained. Pay attention to the breathing. Breathing slow and steady is very important. If possible, make the exhalation a little longer than the inhalation. Feel the movement of the diaphragm. Diaphragm is the major muscle of breathing that divides the chest and the abdominal cavity. Keep both the arms by the side of the trunk, palms facing the floor. As we inhale, raise both arms up over the head. At the end of inhalation, the hand should have reached uppermost region. Then as we start exhaling, bring the arms back. At the end of exhalation, the palms should have again touched the mat. So inhale, rise. Feel the movement, feel the weight of both the arms, and as you exhale, bring it back. Match the action and the breathing. Feel the shoulder joint, feel the clavicle, the collarbone, feel the ends of the collarbone, feel the chest cavity. It gets a good stretch, a longitudinal stretch because of the movement of the arms. Feel your scapulae, the shoulder blades. You can repeat this for about 4 to 5 times. This is a good way to mobilize the shoulder joints and the scapular complex. And this movement associated breathing will also help to reinforce the focus. After you exhale, relax the arms. Stretch both arms up. After the simple movement for the upper extremities, now let us look at the lower extremities. Stretch both arms. Chin towards the chest. Rise your right leg up. Pull the kneecap, stretch the heel, toes towards the knee. Tighten the front of the thigh, the quadriceps muscle, toes towards the knee, kneecap towards the hip. Feel the calf muscle and the back of the thigh, the hamstring muscles. Feel your hip. Also feel the lower back. Right leg down, chain, left leg up. Stretch the heel, pull the kneecap. Hit the back of the knee. That is, you should push the knee back. On the right leg, you should squeeze the hamstrings again at the calf muscle. Press the foot firmly. Tighten the knee capsule. Left leg down. One more time. Right leg up. Feel the muscles of the legs. Toes towards the knee. That helps the gastrocnemius muscle, the calf muscle, to stretch better because of the Achilles tendon. This will further help the hamstrings, back of the thigh. Feel also the hip and the back. And always watch your breathing. Right leg down, left leg. In this posture, the hip is in flexion, knee is in extension on the left side. Right side, both hip and knee are in flexion. Watch all the muscles that are involved. Pay close attention to your breathing. Left leg down. Right leg up. Fold from both hands. Hold the knee. Press the knee closer to the chest. Stretch the heel, toes towards the knee. On the right leg. Then on both the legs, try to squeeze the back of the thigh again at the calf muscle and feel the knee capsule. Press the left foot firmly. Pull the right leg close to the chest. Release right leg, chain. Left leg up, fold, hold the knee, press the knee towards the chest. Toes towards the knee. And tighten the inner corners of both the knee. Watch your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg, change. Right leg, fold, hold the knee, press the knee towards the chest. In this posture, because of the pressure of the thigh on the abdomen, the massaging effect of breathing on the abdominal organs will be much sharper and better. Watch that. So this posture helps the gluteal muscles, the back muscles, the knee, and it also helps the abdominal organs. Release right leg, chain, left leg, fold, hold the knee, press the knee towards the chest. So all these simple movements, they help the core muscles of our system. These core muscles are basically around the lumbar, pelvis and hip complex because they connect the upper extremities and the lower extremities through this massive trunk. So doing all these postures will set the tone of the muscles in this region for better performance. Release left leg. Right leg up, fold from left hand, hold the ankle joint, pull the heel across the left thigh, take the heel close to the root of the left thigh, but how close depends upon the stiffness in the knee. Even here, press the back of the thigh against the calf muscle on both legs. Feel the thick skin or the fascia surrounding the knee joint. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull it closer to the root of the right thigh, push the knee from the left hand, tighten the corners of both the knee. Pay attention to the breathing, be watchful. As we inhale, abdominal cavity should expand, as we exhale, it should contract. Sensitize the base of the spine as we inhale and exhale. Release left leg, right leg up, fold from left hand, hold the ankle joint, taking the heel across the left thigh, push the right knee, feel the base of the spine. This is a gentle movement for the sacroiliac joint, and the articulation between the sacrum portion of the spinal column and the iliac region of the hip bone. Slow inhalation, slow exhalation. Release right leg. One more time, left leg up. Fold from right hand, hold the ankle joint, pull it closer to the root of the right thigh. From left hand, push the knee. Tighten the inner corners of both the knee. Pay attention to your breathing. Breathing is the key. Proper breathing. The diaphragm abdominal breathing helps you to relax better. Release left leg. Both legs up. Fold, hold the knee, press the knee towards the chest. Stretch the heel, that is toes towards the knee. Feel the pressure of the thighs on the abdomen as you inhale and exhale. Feel the effect of breathing on the lower back. Here the thick skin on your lower back also responds very well to the breathing. Just watch that. Make the breathing slow and steady. Feel the lower back. Feel the smooth, soothing stretch. Now release both legs. Stretch your left leg forward. Roll on to the right side. Slowly get up. Fold a blanket. Sit on the blanket, the hips on the blanket, foot on the mat. Palm should face upward. Tip of the thumb and index finger in contact. Inhale, exhale, turn to your right side. Take the left wrist to the right knee, right hand fingertips on the floor. Inhale, exhale, turn. With every inhalation, try to lift the navel and chest up, and with every exhalation, learn to turn more. For this, the right hand fingertip should come as far behind as possible. From left hand, grip the right knee. Turn the neck also in the direction of rotation. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. As you inhale, slowly come up, change. From right hand, lock the left knee. Then left hand fingertips on the floor. Inhale, exhale, turn. Chest and navel up. Feel your breathing. This is a very simple twisting posture for the trunk. Trunk has varied degrees of movements. This is one such simple thing which will help the spinal column. The stiffness in the spinal column, especially the lower back, gets alleviated through this. This posture is also good for the intestinal muscles and organs. Breathe well. Now inhale, come up, sit upright. Watch your breathing. One more time, turn to your right side, left hand to the right knee, right hand fingertips on the floor. Keep on turning. Breathe watchfully. Breathing is the key. These twisting postures help the intestinal muscles and organs. Especially the twisting postures have a great role in eliminating the toxins from this chemical zone, the abdominal cavity. As we inhale, slowly come up, change side. Inhale, exhale, turn. Right hand on left knee, left hand fingertips on the floor. Inhale, exhale, turn, chest and navel up. The trunk should not move sideways. It should twist. But keep the spinal column upright and provide the twisting movement. Watch the abdominal region and also the back as we inhale and exhale. As we inhale, slowly come up, sit upright. Line your chest, stretch the toes back, rest the forearm on the mat, middle finger pointing forward. Take the elbow below the shoulders. Inhale, exhale, rise the trunk and navel up, but ensure that the base of the thigh do not get off the floor. Stretch the toes, tighten the calf muscle. But press the forearm, middle finger pointing forward. Simple backward bend to the complete spinal column. You have to look up, bend more from the cervical spine to the neck. Chest up, navel up. This is a very simple backward bend to one and all. Slowly come down. One more time. Inhale, exhale. You rise and stay there. And when you are staying, do not hold the breath. Breathe at ease. Breathe well. Stretch the toes back. You should extend the neck, that is, bend it back, and then try to look up. Slowly come down. Recognize that the elbow and wrist are on the floor, palm facing down, elbow is right below the shoulder joint. Now fold the toes in. Rise the hips up. Legs straight. Upper arm perpendicular to the ground. Foot perpendicular to the ground. As we inhale, abdominal cavity should expand. As we exhale, it should contract. This is a good movement for the shoulders, back, and the foot. Slowly descend. Be relaxed. Fold the toes in. Press the forearms. Inhale, exhale, rise. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Feel the back, the scapular region, the thoracic region, and the lower back region, and then the base of the spine. Slowly descend. Now so rise the hips up, walk a little forward, keeping the forearm firmly pressed on the floor. Stretch the spine, straighten the legs, press the heel on the floor. Both feet firmly grounded. Stretch the spine, chest up, navel up. Slowly take the legs back. Come down. This particular posture involves the scapulae, the back and the legs. The complete shoulder complex is involved. One more time, keeping the elbow and wrist pressed, rise the hips up, walk inside, legs straight, press the heel firmly against the mat, stretch the spine. Spine should not buckle. This movement is very good for the arms, legs, trunk. Slowly walk back and relax. Rest the forehead on the floor. Keep both the palms by the side of the forehead. Inhale, exhale, rise. Press the palm. Stretch the toes back, tighten the calf muscle, squeeze the buttocks. Bend back as far as possible. Then open the shoulders, lift the neck and bend back. A good hyperextension for the complete spinal column, good stretch for the pelvis, abdomen and the chest. Do not hold the breath. Chest up. Well, open the shoulders. Lift the neck up and bend back. Slowly come down. Keep the elbows closer to the trunk. One more time. Inhale, exhale, rise. We'll open the chest. Bend back. Stretch the toes. Squeeze the calf muscle. Tighten the buttocks. And then bend back. Feel the pressure on the palm. Pressure on the wrist, elbow. The pressure on the wrist is coming from at an angle. Watch that. Press the palm completely. So pressing the palm also energizes the reflexology points on the surface of the palm. Breathe well, feel the backward bend. Slowly come down. Be relaxed. Watch your breathing. Now keep the palm by the side of the shoulders. Fold the toes in. Inhale, exhale, rise. Dvipada Prasanasana, trunk parallel. Arms perpendicular, foot perpendicular. Toes folded in. Arms straight, legs straight. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Feel the weight on both the arms, elbows, wrist and the palm. As we exhale, slowly flex the elbows and come down. Keep the palms firmly on the mat, middle finger pointing forward, wrist below the shoulder joint. Fold the toes in. Inhale, exhale, rise. Taking the trunk up. Both legs straight. From the base of the metatarsals to the heel, foot has to be perpendicular. Watch your breathing. Stay connected with the breath. Hold the posture. Feel the posture. Slowly flex the elbow, flex the knee, come down. Be relaxed. Keep the palm below the shoulders. Inhale, exhale, hips up, head down. Arms straight, legs straight. Press the palm, press the foot. Legs straight. Hip should go as high as possible. Head should come as close as possible to the mat. Keep on stretching the spine. So in this, the complete arms, legs and back are involved. Adho Mukha Svanasana. Flex the knee. Come down. One more time. Press the palm. Inhale, exhale, rise. Hip as high as possible. Foot firmly pressed down, legs straight, stretch the spine, taking the head closer to the mat. You have to press the palm and push the shoulder blades up and closer so that the chest gets a good opening. And the diaphragmatic movement can be felt better. Slowly flex the knee, come down and be relaxed. Slowly get up, turn to your right side, rest the right elbow on the mat, right elbow, hip and ankle in same line, left hand on the waistline, inhale, exhale, rise the hips up. Roll the left shoulder. If possible, stretch your left arm also up, look up at your left palm. Both legs straight. Watch the foot. Slowly come down and chain. Press the right elbow and the palm on the floor, right hand on the waistline, elbow, hip and ankle joint in same line. Inhale, exhale, rise the hips up. Well, open the chest. Do not push the hips out of the plane. Now raise your right hand, look up at your right palm. Both legs straight. Slowly descend. One more time. This is a simple movement that could give the stability. Press the right elbow, left hand on the waistline, legs straight, hips up, stretch your left hand, look up at your left palm. Well, open the chest. Watch your breathing. Slowly come down. This posture helps the spinal muscles in terms of strength and stability. Chain. Left elbow on the mat, right hand on the waistline. Initially you should flex the knee, then as you rise the hips up, straighten both the legs. Well, open the chest. Stretch your right arm, look up at your right palm. Ensure that the legs, hips and trunk, they are in the same plane. Watch your breathing. Slowly come down. Slowly get up. Rest the right palm on the floor, middle finger pointing sideways. Flex the knee, left hand fingertips on the waistline, rise the hips up, stretch your left arm, look up at your left palm, both legs straight. Here both arms are straight, that is to be seen. Watch your legs. Take the left hand down, then bring the hips down, chain. Press the left palm, left wrist, hip and ankle in the same line. Inhale, exhale, rise. Right hand on the waistline. Stretch your right hand up. Turn the neck, look up at your right palm. Attend to your breathing also. As you inhale, abdominal cavity should expand, as you exhale, should contract. Legs, trunk and arms should be in the same plane. They should not move out of plane. Keep both arms strong. As we exhale, slowly come down. Then change. One more time, right hand, look up at your left palm, both legs straight, feel the pressure distribution on your right palm, right hand absolutely straight. Slowly come down, change. Press the left hand, middle finger pointing sideways, right hand on the waistline, inhale, exhale, rise. Initially remember you should slightly flex the leg and be there in the sideward position. As you exhale you should straighten the legs and rise the hips up. Right hand up, look up at your right palm. Slowly come down. Sit upright. Sit on the folded blanket, hips on the blanket, foot on the mat. This way it's easy to sit upright. Now fold both legs to the right side. Sit upright, both thighs should run parallel. Knee facing forward. From right hand hold the left knee, left hand fingertips on the floor. Inhale, exhale, turn. Bharadvajasana. Chest up, navel up. This is another simple twisting posture. Very useful one for invigorating the intestinal organs and muscles. Also helps to reduce the stiffness in the back. With every inhalation, stretch the spine up. With every exhalation, twist the spine. Turn the cervical spine also. That is the neck also in the direction of the twist. So experience that complete stretch and twist. Slowly come up, change side. Both legs folded, foot to your left side. From left hand hold the right knee, right hand fingertips on the floor. Inhale, exhale, turn. Grip the knee firmly, press the floor from the right hand fingertips. Take the right hand fingertips as far back as possible and twist. Chest and navel up. Here the hip girdle is fixed and the shoulder girdle twists. That's how you get a nice twist for the complete trunk. Slowly come up. One more time. Sit on the blanket, hips on the blanket. Take both foot to your right side. From right hand grip the left knee, left hand fingertips on the floor. Inhale, exhale, turn. Well, open the chest. Pay attention to your breathing. So in all this twisting, breathing is to be properly implemented so that the mechanical effect of twisting is usefully exploited. Chest and navel up. Slowly come up. Change side. Both legs folded towards left side. From left hand grip the right knee, right hand fingertips on the floor. Inhale, exhale, turn. Watch the complete spinal column. Stretch well, twist well, and with every inhalation, exhalation, feel the spinal muscles. Turn the neck also in the direction of the twist. Watch your breathing. Slowly come up. Sit on the blanket, hips on the blanket, foot on the mat. Sit upright, chest and navel up. Watch your breathing. You're going to do the diaphragm abdominal breathing. As you inhale, the abdominal cavity should slowly, gently expand, and as you exhale, the abdominal cavity contracts. Chest as neutral as possible. Feel the movement of the diaphragm. Diaphragm is the major muscle of breathing, which divides the chest and the abdominal cavity. Initially it will be in the form of a dome into the chest, following the signal from the brain. This muscle contracts. As it contracts, it flattens towards the abdominal cavity, pushing the abdominal viscera down, and that is how the abdominal cavity expands. And air gets into the lungs. When the diaphragm relaxes, it moves into the chest, compressing the lungs. Air comes out, the abdominal region also contracts. Watch the abdominal cavity, the front, the sides and the back. As we inhale, the bottommost portion should expand, followed by the middle and then the top. And try to exhale longer than you inhale. If you can, you should get into what we call as 1:2. That is, if you inhale for about 4 to 5 seconds, try to exhale for about 8 to 10 seconds. Keep the shoulders even, chest up, navel up. Palm should face upwards, tip of the thumb and index finger in contact. Be focused. The abdomino-diaphragmatical breathing is one of the simplest breathing techniques and one of the techniques that helps one to relax. Be aware, be watchful. This is a very, very relaxing, rejuvenating breathing techniques. Watch the flow of the breath through the nostrils. Which nostril is dominant? You should watch. Be aware of what you are doing. Next we are going to do forced exhalation, automatic inhalation. In this, contract the abdominal cavity, expel the breath quickly, forcefully, then relax the muscles, the air automatically gets in. So this is forced exhalation, automatic inhalation. Initially use minimal force and do not hurry to make too many number of repetitions. Start with few number of repetitions. Maybe you can do some 30 or 60, or if you are well toned about 100, then relax and then repeat such sets. As you exhale, contract the abdominal muscles, quickly exhale, relax the muscles, the air automatically gets in. Just watch. But remain seated upright. Do not compromise the posture. You are doing forced exhalation, automatic inhalation, then simply relax. When you relax, there will be a brief period where there is neither inhalation nor exhalation. Experience that stillness, at least for a few seconds. This is another very good breathing techniques to invigorate the abdominal muscles and organs. One more time. Forced exhalation, automatic inhalation. In the beginning, do not use too much of a force, a mild, gentle force. Repetition. Also do not go for too many number of cycles to begin with. You can start with some 20-30 cycles per set and then slowly progress. Your body and mind should get tuned. Forced exhalation, automatic inhalation. Then simply relax. In this technique, the oxygen level in the blood goes up momentarily, and therefore there is going to be a brief period of stillness where the brain does not demand for further inhalation. For very few seconds, experience that deep silence. One more time. Contract the abdominal muscles, expel the breath quickly, forcefully, relax, the air automatically gets in. So initially some 3-4 sets you can do. Then think of increasing appropriately. This technique also has a positive impact on our nervous system. But one has to practice steadily for a good length of time, that is very regularly, to reap the benefits. Watch your back, the region behind the navel and the lumbar region and the base of the spine as you do this. And relax. Feel the deep quietude. Just watch yourself, feel the inner calmness, quietness. Now we are going to do a basic technique to understand and improve our ability for sustained attention. We are going to count from 50 to 1 in the descending order. This has to be done mentally without moving the tongue or the lips. Internally you have to count, and in between the counts there should be a gap of about 3 seconds. That is, start with 50, 49, 48, more or less in that speed. Don't be in a hurry, be calm. You can start now. You are counting from 50 to 1. As we are doing, see what is happening in between. Is your mind focused? Are you able to keep track of the counting? Is the mind too distracted and not able to count? Or you are able to count but still the mind wanders rapidly? You are missing counts, but you are able to come back to counting. Just watch. This is a simple test to get a brief about the status of our mind. Focus on your counting. Mind is generally very turbulent in nature. It can get stuck somewhere and you are not able to move away from that. That is the kshipta avastha. It can oscillate. Sometimes you are able to focus. Suddenly you lose the focus, the mind takes you somewhere. Again you are back, again you are going. So it can be oscillatory, vikshipta avastha. Sometimes it does not allow you to do anything. A lot of tamas. You feel drowsy, sleepiness, confused, mudha avastha. If you can be focused on the counting, hold the attention on the counting, even in the gaps of the counting, the mind is able to be there. That is ekagrata avastha. By now you should have counted Just take a look at what really happened, what was the state of your mind, make a self-assessment. These are all techniques to improve the focus. Namaste.